Hello everybody, this is Dr. Bassam Hamid Salama again with the Simplified Medicine episode number 2. We are going to talk today about the gastroesophageal reflux. The gastroesophageal reflux occurs when the junction between the stomach and the esophagus relaxes, allowing the passage of acid from the stomach upwards to the lower end of the esophagus, which is not protected by a mucous membrane, creating a lot of irritation. And the patient usually complains of sensation of fullness, discomfort, sometimes difficulty in the swallowing. Sometimes the patient says, I cannot eat as much as before. Sometimes the patient complains of hyperacidity, pain at the center of the chest. If regurgitation happens during the night, he may feel choking, and the patient may also complain of recurrent cough, which is not responding to the ordinary anti-cough medications. The patient may complain of change in the voice, may complain of repeated laryngeal inflammation, and may complain of stomach pain, which does not go away except after the use of antacids. Sometimes the patient complains of discomfort before or during the sleep as well. Most of the patients who complain of gastroesophageal reflux go to the pharmacy and purchase the antacids on their own as OTC, over-the-counter medication, and they usually come and tell the doctor that I'm using this and that antacid to relieve my pain. It's very important to know the risk factors which may promote for the occurrence of gastroesophageal disease or the gastroesophageal reflux. The first risk factor is morbid obesity. The second one is eating large meals, and the third one is eating immediately before the sleep. The fourth one is drinking alcohol. The fifth one is drinking too much soft drinks containing caffeine and the cola drinks and the Pepsis, etc. Also taking some medications like analgesics and painkillers, non-steroidals, diclofenac sodium, salicylate, provided that the salicylate is in the bigger dose, which is 500 milligram per day. Salicylates, which are low dose, like the cardioprotective tablets, 100, usually do not cause irritation in the stomach. And sometimes these tablets get caught so that they become enteric coated, or they are wrapped with a special type of label so that it does not hurt the stomach. Let us go now to the complications which may happen as a result of gastroesophageal reflux disease. Stricture may happen at the lower end of the esophagus. Extreme irritation, ulceration at the lower end of the esophagus may create atypical cells. With the passage of time, these atypical cells may turn malignant. How to reach to the diagnosis? Most of the people who are coming with gastroesophageal reflux disease, they don't know that they have the disease. They may think that we have irritable bowel syndrome, they may think we have gastric ulcer, and most of them, they use the antacids haphazardly. There is a few patients which complain of short irritative cough, which does not respond to the anti-cough medications. They go to the pulmonologist and they may consider themselves as having asthma or chest allergy, which is not. Their problem is in the reflux itself. There should be also exclusion of the surgical causes of the problem, for example, hiatus hernia. There should be exclusion of the H. pylori, which is a microbe causing the peptic ulcer. It should be tested in the stomach. After exclusion of all the other possibilities, we have to monitor the reflux of the acid from the stomach to the lower end of the esophagus by the use of ambulatory acid pH probe test, which is usually done via a nasogastric tube. We can also use manometry to measure the pressure in the esophagus and to discover achalasia of the cardia. Achalasia of the cardia is a disease in which it's difficult for the smooth muscles to relax. There is another way of discovering the diagnosis, which is barium meal. It's an X-ray after the ingestion of barium liquid. Barium is an isotope, and it will make delineation of the interior wall of the esophagus and the junction between the esophagus and the stomach. The only disadvantage of that technique is that it is used for the diagnosis of the complications, which are esophageal stricture and probably esophageal carcinoma. In the early stages, it is not too much helpful in the diagnosis. The doctor should exclude other diseases related to the immunity, for example, HIV. If the immunity drops, the patient may get viral infection in the esophagus, like herpes virus. He may get fungal infection, and both viral and fungal infection of the esophagus, in case of dropped immunity, will lead to similar symptoms. So the doctor should not be fooled, and he should make it in the differential diagnosis. And to list the differential diagnosis of GERD or gastroesophageal reflux disease, we have to consider peptic ulcer, hiatus hernia, achalasia of the cardia, viral and fungal infection, chest allergy, and heart attack. The available medications for the GERD include antacids, for example, ranitidine and omeprazole. And they include as well the baclofen, which is a medication used to make relaxation in the smooth muscles. And finally, we have to comment about the surgical intervention, which may be used to treat the complications of gastroesophageal reflux disease. There are two operations, namely fundoplication and Link's device. Fundoplication is a surgical intervention in which the upper end of the stomach gets corrugated around the opening so that it strengthens the opening, not allowing the acid to regurgitate back to the esophagus. As far as Link's device is concerned, it's magnet device which helps to strengthen the closure of the gastroesophageal junction. It comes in two rings which are installed one after each other, and because of the magnetic property, they help to increase the tone at the gastroesophageal junction, and this will help to decrease the symptoms of the GERD. Finally, I want to pay the attention to everyone not to assume the diagnosis. Let the doctors diagnose your case. Don't take even antacids without the prescription of the doctor, because you may use it in a wrong way. You may use it for a long period of time and you don't know the diagnosis. You have to be diagnosed by a professional doctor. I hope that the content of this episode has attained your interest, and I hope that you follow me on the Chaos Cat channel on